Preterm birth disproportionately affects low-income women and women with low educational attainment. Societal factors like these have led some people to label prematurity a social disease.
One of the issues with prematurity is we've always viewed that as kind of a medical answer for prematurity is what we're looking for. And in fact, we need to view prematurity more like we do our other health problems. And there are many, many other determinants of preterm birth other than just what's going on medically.
Home visitation programs which provide one-on-one support for new parents have proven that caring relationships can help families cope with a range of life issues that can affect a woman's pregnancy. Across the state, the HANDS program, which stands for Healthy Access Nurturing Development Services, matches first-time moms and dads with a dedicated support person.
It's a health education program, but we also really work on teaching them family self-sufficiency and family support. And in that program, in our teenage moms, who you would think be the highest risk, we have cut the rates of premature birth in half. And have a huge impact on prematurity if we broaden our scope to not just thinking about the medical issues, but thinking also about the social issues and the economic issues and the environmental issues that people are in, and try to address some of those problems, which we now call the social determinants of health.
Income determines the kind of job that you have, whether or not you have health insurance, where you're going to live, what your nutritional status is going to be, whether you're living in a safe environment or a not so safe environment. The job you have is also directly affected by income and the kind of exposure you may have in that job. People who are poor have jobs that are much more dangerous and have a much higher exposure to toxins and potential dangers and stress levels, all of which are impacted on the pregnancy.
Traditionally, when folks think about inequities, they think it's a personal responsibility issue. If that person only exercised, if they'd eaten better, if they'd done certain things, and they fail to take in the contextual aspects of it. So they forget that people are placed in a neighborhood that have certain circumstances. Disparities in premature birth are pretty shocking, actually. I'm stunned to see women who could be, first of all, from the same neighborhood, and one person be white and one person be African American, and know that the African American woman is twice as likely to lose her baby either before birth or within the first year of life. And so it makes you step back and ask the question, what's going on? So there's a lot of research out there that talks about it's the continuum of life events and the increasing of stress and the disproportionate existence of stress and racism that people face in the community.
In addition to being the director for the Center for Health Equity, Lisa Toby is also pregnant for the first time and will raise her baby as a single mom.
When I look at the folks that are in Healthy Start or the neighborhoods that we work in that are going to be single parents or even have partners that are with them, I'm in awe of them being able to do this parenting thing, you know, on something that could be the equivalent of $12,000 a year. I don't know how they do it. And so when I look at that, I'm stunned at the fact that anybody would look at folks in those communities and those neighborhoods and have anything less than respect for their ability to raise a child. With me, I'm going to walk into the situation with so many privileges, it's not even funny.
Lisa Toby's privileges include being able to drive to a quality grocery store in her neighborhood where she can afford to buy healthy foods. Pregnant mothers in western Louisville have few other options than high-priced convenience stores without fresh produce.
We need to also get a clearer perspective on the things around us that impact our health and the advantages we start with or the disadvantages we start with. So it's one thing to say, I grew up poor, and if I did it, anybody can do it. You need to, when you start stacking up the barriers for some of the folks that we're working with, that you can see that them overcoming those barriers, it's not impossible. We just need to know that they're trying to overcome 10 things. I might be trying to overcome 2 things.
We, in this business, say, you know, health policy, good health policy is social policy, and good social policy is health policy. And economic development feeds a healthy community, and a healthy community feeds economic development. So it's, again, it's a wraparound, comprehensive look at society and how we address our issues.
All public health is about prevention. And the way to prevent things is to start early. And we find more and more, the earlier we start, the better off we are. I guess I'm passionate about it because I believe, like Marian Wright Edelman said, is that our children are a sacred trust. and that it is our responsibility as adults to give them the best start in life that we can give them. And that's what builds our families, that's what builds our communities, and that's what builds our nation. And I think that's why we're here.